It's a very beautiful morning in the city of Enugu State. Good morning, everybody, and welcome to yet another wonderful day on radio. Welcome our listeners to another informative edition of Glaucoma on radio, proudly brought to you by the Eye Specialist Hospital Tesh, Enugu State, in partnership with Solid 100.9 FM. Chibika James is my name, and it's always a pleasure having you join us as we continue our mission of creating awareness about glaucoma, a silent disease that remains one of the leading causes of irreversible blindness across the country. Well, ladies and gentlemen, growing old or growing older is one of life's greatest blessings. You know, sometimes you see everyone pray that they get to grow old and live as many years as possible. Alright? And it's also said that with age comes wisdom, experience, cherished memories, and the opportunity to watch children as well as grandchildren grow. But as we celebrate this golden years, we must also pay close attention to our health, especially our eyesight. Okay? Many eye conditions, as we have always said on this program, becomes more common as we age, and glaucoma is one of them. The challenge is that glaucoma often develops quietly. It usually causes no pain, no redness, no obvious warning signs until vision has been permanently damaged. Now, this means that older adults may feel perfectly fine while gradually losing part of their vision without realizing it. And if it is left untreated, glaucoma can affect everyday activities such as reading, recognizing faces, working safely, taking medications correctly, and maintaining independence. And it can even increase the risks like falls, accidents, and it also affects not only the individuals. Okay, it doesn't affect the person that is diagnosed with glaucoma, but it also gets to affect the family members as well. It affects the caregivers. It affects those who love to support them. Because one way or another, they might see them as burdens. But the good news is that blindness from glaucoma is not inevitable. Blindness from glaucoma is inevitable. With regular comprehensive eye examination, as well as early diagnosis and consistent treatment, many people can preserve their vision and continue enjoying an active and independent life. And that is why today's conversation is so important. Our topic today is golden years, healthy vision. Golden years, healthy vision. And in this, we're talking glaucoma care for older adults. So if you are an adult or you are a child who have an adult parent, you should listen to this. In short, it's for everybody because we all are going to get old. So it's best we equip ourselves with these knowledge. So once again, golden years, healthy vision, glaucoma care for older adults. And joining us this morning to help, unpack this wonderful discussion that we will be having right here in the studio is Dr. Obina Shiwobi. Doc, good morning, sir, and good to have you.
Good morning.
All right, Doc. Let's start with the basic, what we always talk about. Let's get to educate our listeners as to what glaucoma is all about.
Yeah. Okay. Thank you, Chibike. Good morning once again. We want to also express our appreciation to Solid FM for this beautiful social responsibility to our people. Whether you want or not, this is yielding fruit, and I think our people are listening. So, like you asked, glaucoma is the commonest cause of irreversible blindness worldwide. Commonest among the blacks, and in Africa, we said it's commonest in West Africa. Then in the Nigerian study, it's commonest among the Igbos, and we have found out that it has to do with our genetics. And very importantly, we've also said that anybody can have glaucoma. Commoner with aging, commoner with the older age, 40 years and above, commoner with 60 and above. And that we advise everybody that the disease has very late symptoms. That by the time it becomes symptomatic, by the time there's a problem, it is already an advanced stage. So these are very important issues. One, that it is real. It is not a hypothetical statement or disease. Secondly, it is the commonest cause of irreversible blindness. And from what I just said, common among the Igbos and any other tribe in Nigeria or any other tribe in Africa. So we also want to say that it is very the symptoms come quite late, and that's why we call it the thief of eyesight, because the symptoms come quite late, and people should know. Don't wait for the symptoms, because if you wait for the symptoms, you get yourself so embarrassed, when they tell you this is an advanced stage. So that's what happens when people come for the first time. Tell them, you have an advanced glaucoma, and they're like, when did it start? When did it come? So what is that? So that is actually what our people go through. So I want to plead with you, let this continue, because I think it is yielding fruit to our people. Thank you.
All right, yielding fruit to our people. Yes, and today's conversation: golden years, healthy vision, glaucoma care for older adults. Doc, today's program focuses on older adults. Why does the risks of developing glaucoma increase as people grow older? And what changes occur in the eyes that makes aging a significant risk factor? Is there like something that happens to our eyes when we started getting old, and that is the reason why glaucoma happens to the older people more often?
Yeah, TVK, like how they say, the older car visits the mechanic, more than the new car. Yeah, so with aging, a lot of things begin to, the functions are no longer as active as they were. We know that with aging comes up a lot of diseases. Now, exceptionally for the eye, for the issue of glaucoma, we've known that it is common among people of age of 70. The older you are, the more likely you are likely to have glaucoma. I mean, this is established. There's no argument about it. It can happen at any age, but very common, above the age of 60. Now, because there's a balance in the eye. Football is kept to the way it is with air. When you pump air, it bloats up and then it remains there, so people can kick it and it will not, get less. So when it comes to glaucoma, when it comes to the eye, there's a balance. What keeps the eye the way it is, firm, is fluid. So there's a balance between production of aqueous humor and the drainage. So that balance, once it is maintained, the eye will have no issues. And those aqueous also supplies nutrients to the avascular tissues of the eye, to the cornea and to the lens. So, and it also has antibiotic properties, so keep the eye sterile. So with aging, the drainage pathway tends to narrow, tends to be less functional, while the product aqueous production remains almost the same. So when that happens, there's a build-up of aqueous humor, and it is this build-up that increases the intraocular pressures of the eyes. And we say the only amenable risk factor in management of glaucoma is the intraocular pressure. So when this intraocular pressure builds up, it affects the optic nerve, the nerve of vision. You are surprised how what happens in the anterior part of the eye affects what happens in the posterior part of the eye. So it's when these pressures build up, the homeostatic function of the eyes, the normal balance, the way the eye functions, especially the optic nerve, is grossly affected.
Okay.
Now, another thing is the one tissue that grows all through life is the lens. And now the lens forms the posterior part of the of the anterior segment of the eye. And when it keeps growing, it tends to grow anterior-posteriorly. As per it grows, moves forward. And that move forward means it moves iris forward too, and also narrows the drainage angle. And then we know that the pumping mechanisms of the drainage angle that tends to help in drainage also weakens with age. And we also know that blood flow to the optic nerve also reduces with age. We also know that the nerves that help in the drainage also grow weaker with age. So these are factors. And then the risk factors to glaucoma includes hypertension and diabetes.
Wow.
And these are also also commoner with aging.
Yeah.
So these factors make the eye more prone to having glaucoma in older age than in the younger age. And it is the same with every part of the body. We know that aging throws in. We don't know what age will throw. Old age will throw to anybody. Nobody knows. You and I, we don't know those who will go blind, those who will stop hearing, those who become visually impaired, those who become unable to walk, those who become unable to do normal day-to-day activities. And very annoying one is the one people who lose their memory, unable to recognize wife or husband, recognize children, unable to do basic tasks. This all come with aging. And I think our people should know. People say you age with grace, with grace. You age with let me say, the Gen Z word is you age with not grace. You age with what did they say? I remember it.
You're not a Gen Z, so
yes. I remember what they say.
Yeah.
So with aging, the eye becomes more amenable to having glaucoma.
But is that something about the aging that makes it more prone to glaucoma?
Yes, just like we said, the drainage angle. The increase in the size of the lens. The reduced blood flow to the optic nerve. And the weakening of the nerves too, happening in the drainage pathway. The fact that drainage pathway becomes narrow with aging, tells you why there's a problem.
Okay.
So, and then in all these things, what do we do? Nothing but ensure that this revered father or mother, who is now getting old, increases his or her uptake of checkups. Not only the eyes but the entire being, the entire body. Like we said earlier, that the older car visits the mechanic more than the newer car. Because every part begins to wear down. And this is what aging does to our entire being. It can't. There are things. Before you know it, you see people start. They can't read basic things again. Prints. They have to use glasses to read. They can't look at their phones. They have to use glasses. So these are all aging processes, I know, and when they come, the eye is not excluded because the eye is also aging, and there are conditions where the eye is age older than the body, what we call age-related macular degeneration. But we're talking about glaucoma now, so these are issues, these are facts that can actually lead to the older age being prone to having glaucoma than the younger age.
All right, but Doc, it is said that the eyes is one of the most important part of the body. Glaucoma doesn't just affect the eyesight. It can, also affect a person's confidence and independence. Because when you cannot see properly and you need help of someone before you could able to do a few things, you are low in confidence. Could you explain how untreated glaucoma may interfere with daily activities such as reading, moving around safely, recognizing faces, taking medications correctly, and even maintaining an active lifestyle?
Yeah, thank you, Chipike. Now, glaucoma affects the optic nerve, that's what we call the nerve of vision. Once vision is impaired, your daily activities are also going to be impaired. One thing the aged enjoy is that those who still keep up their routine activities, despite their aging, when they get to 70 and they're able to walk, able to listen, able to hear, able to see, it will say these people are aging with grace. Now, these are important issues. The vision is so important to maintaining daily normal activities. Moving from the bedroom, moving the bedroom to the sitting, to the living room, from there to the dining, from there to the toilets, from there to outside. So, and for those who are old, who are now retirees, they tend to read more, look through the newspapers, and get themselves engaged in things that are beneficial. Now, when the vision is impaired, it affects almost the entire being. The patient is unable to read, so it leads to frustrations. Patient becomes so anxious, and he wants to regain his vision, and whether he wants it or not. And when the patient is unable to do basic things, and he's being helped to do those things, there's low esteem, confidence drops, and if that visual impairment is not arrested, if patient does not, if the doctor does not institute, if the patient does not come to hospital and the proper diagnosis is made, patient is well investigated, all the parameters are well established, and the patient is put on a particular therapy, to maintain that particular vision. We call it navigable vision, which is so important. Navigable vision in the sense that patient can maintain some basic activities like moving from one room to the other, so that everybody can leave the house and the patient will still be able to go to the fridge, take a bottle of water, a cup of water. Do you understand? If he's hungry, take one thing, maybe a slice or two slices of bread to take. Now, if these are affected, there's going to be low esteem, and the patient becomes so anxious, and whether they want or not, it affects the patient's confidence. Patient cannot confidently take a task because he's visually impaired, and this leads to frustrations and so much unhappiness. And then, very importantly, it is established that once this is not stopped, a patient progresses to severe visual impairment or blindness, that lifespan drops. Because the patient feels, I don't want to use the word useless, the patient feels I'm a burden to my people, because the patient can no longer be left alone. The patient somebody has to be at home. Now that person who has to be at home is forfeiting something. It's either forfeiting education, forfeiting work, or forfeiting something, maybe going to learn a trade, or forfeiting, being of use to him or herself. So you can see how it's now not only affecting the person, it's now affecting the people, the loved ones. And we know that whoever has a blind person, that relations, loved ones also get so unhappy about it. So why we say this is that once you're old, don't take it for granted. I mean, God has been nice to you and you got into that age. Do the basic thing. Basic thing is that, like I said again, we use this issue of car. When the car is old, I like this car. What do? You do at least frequent checkups, frequent you change the oil more, frequent you make sure that this car is well maintained.
True.
And you do the needful, that this car, so that this car does not just pack up. It does not have a knock engine, does not get because you're avoiding things that will cost you so much money, because the car has been serving you. So this car is sent for service, so that you want this car to be maintained. So also, and more importantly, that body, that being who has labored to ensure that his children are well, have gone to school, are now are well educated, are now working, and even those who are sending their children to learn one trade or the other, and the children are not doing well. It's obvious that the children also want their dad or mom to also live a good life in his or her old age. So very importantly, we ask our people, the older you are, don't pity your children and say, no, I don't want them to waste money. No. If you want to maintain a good life, then money must be spent.
Mr. Obina, sorry, Dr. Obina, some of the people listening to us right now, older patients listening to us, they already take medications for conditions like high blood pressure or diabetics and other aging diseases and all of that. Can they successfully manage glaucoma treatment alongside these other conditions without becoming overwhelming? Because it's crazy, you taking medications for so many things all in one body.
Yes, it is obvious. It is an established fact. The older you get, the more you start having diseases that are called chronic diseases. That more they come with aging.
Yeah. And
then we say, if you have this, if you have hypertension, and then you have diabetes, they are there. You can manage them, do their drugs, and then you now come down with glaucoma. There's no need to throw in the towel and say, this is too much, I'm overwhelmed. You can. Many parents these days, when they bring out their pharmacy shop, some have theirs in bags, and then some, have theirs well packaged, see them, every drug is well identified. Some are well timed. I don't know when they've been in a vehicle and you see that at a particular time the person's alarm goes on and the person brings out his or her eye drop and applies it in the two eyes. So you get happy with people who do these things. And what are they doing? They want to maintain maintain the life they had before, to keep it going, and also to keep their loved ones happy, and then not to lose. Not to be too independent. They want to remain active. They want to be able to do their daily activities independently. They don't want to be a burden. So I advise our revered oldies to take good care of themselves. It is not asking for too much. Ask a child that it is time for you to have a checkup. Yes. So for those who want to buy you cake and buy you this and do this for you, like it is a birthday, beautiful. So the birthday should be celebrated. But before then, ask, please. You want to go for a checkup before your birthday? There's no better birthday gift than that.
Yeah.
So you should. And for those, don't get overwhelmed. You're taking drugs for diabetes, taking drugs for hypertension, taking drugs for glaucoma, taking drugs for arthritis, taking drugs for peptic ulcer disease, and so what? Win the war. Don't allow these diseases to defeat you or affect your psyche, don't affect them, affect your confidence, or make you feel less a
Less of
human,
yourself.
or make you feel that, let me say, well, they're not a vegetable, Yes. So I think people should realize this. Taking drugs in old age.
Okay, Doc, you talked about some of the ways at which patients get to remind themselves about. But I would love for you to throw more light on that. Maybe share some practical advice that you could give for older adults to remain consistent with their glaucoma treatment.
Yes. Okay. Thank you. So some have put alarms. Some put it on the walls.
They're menacing on the walls.
Yes. Yes. Some put it on the walls. You see it well. Strapped. They place it on the wall, so they take a look at it. Especially a place they pass each time, so they get to be reminded. Some put at the alarms at which time, like when the drugs are given to you in a standard eye hospital, those drugs are labeled. I mean, all the times are put there: 6 a.m., 11 a.m., 4 p.m., say 9 p.m. So with that, you can actually put it in your phone, so that, or you have an alarm watch, so that at that time it rings. So it's time for my medication. Now it is gross irresponsibility for one not to be taking the drugs as at when due. Now a drug is meant to be applied 4 times a day, and then you take it twice a day. He said, that was when I remember, though. I'm a busy person. No. You can always help yourself, because it is you. It's not the doctor that is suffering. It is you. So then we say with alarms, then the people who have caregivers around them, we also talked about these caregivers. Show love, because you don't know what old age will bring. Just do your best for your loved one, and don't make the person look like a burden. So the caregivers, we'll find out that patients who stay where there's love, where people care, live longer, and then they do better with drug compliance, because there's love. And even if for those who are not happy, why must I be using this drug? I'm tired. But because of love around them. Because when my daughter calls now, she will be annoyed with me. When my son comes,
ask when I be taking your medicine.
Because they'll ask that question. And because you don't want to tell them lies, you can apply it. So I think it is all about discipline. And our people should realize this, that the older you grow, or the older you get, you are more likely to be dependent on medications. And that's why we say, for the younger ones, start doing basic things. Basic things as exercise. Basic things as, what you eat. Basic things as your mindset. Basic things as don't overwhelm yourself with work. Tend to rest. There's no alternative to rest. So our people should know these are basic things, and begin to do them now, not when you grow old. So that at older age you are athletic. You don't need to walk with a walking stick, and that people see you. They say this man is 80 years, and look at the way he walks briskly. His eyes are sharp and everything. I think So for those who inculcate positive lifestyle, who eat well, who do exercises, who rest well, when these diseases even come in older age, they are better able to manage them, and theirs will not be as serious as those who live sedentary lifestyle.
True.
Or those who take too much junk foods, too much oil. So they are better. They're able to manage these diseases. And when they tell you, I've been hypertensive for 20 years, I've been diabetic for 35 years, you're like, and you're like, still look this way. Yes, because they started on time to take care of themselves. Even now, when these diseases came, these diseases were unable to overwhelm them. And then our people should realize this. I mean, every disease is a war. I keep telling my patients, every disease is a war. Like glaucoma, fight the war. Don't throw in the towel. If there are modes of management. Drugs first, and it's not working, we can do laser. Laser doesn't work, we'll do surgery. Many a time the surgery does, 95% of the time the surgery does the needful. The people can be also have lasers first or surgery first, depending on the condition. Like for children, the wisdom is to do surgery first because of the number of years ahead of them. So our people should realize this. Don't make yourself more sick. Let me use that word. Don't throw in the towel. Just fight the war. Be courageous. Be brave. Be disciplined. Use your drugs. And somebody says, I'm going to use this drug for life. And I said, won't you eat for life? Don't you want to work for life? Don't you want to see for life? Why is this for life a problem? If your beard turn white, will you go and call police? No. You don't need to call police now. These are aging things that happen. So our people should realize that aging is not a cause.
Yeah.
It is what my brother Chibika was what he said earlier. We all want to grow old, but we want to grow old in good health of body, mind, and soul.
Yeah. But Doc, I want you to share, some of your personal experience with some of your patients, okay? Because we would like to know what it looks like firsthand. Now, for older adults who have been diagnosed with glaucoma, that news can be sometimes frightening. I don't know. I would like to know how do your patients react when you give them that kind of news, and what message or words do you give to them? You said that you tell them that this is a war. Aside from that, are there other things that you share to them? You tell them to, make them remain hopeful and committed to their treatment.
Yes, thank you so much. Now, for those who see well and they come back with glaucoma, and you tell them there's glaucoma, and it's also advanced, and then it's advanced on one eye than the other, and they are alarmed, so I'm going blind. That's the first question. That's the first response. You tell them, no, you're not going blind, because you have come to seek help. So we are not going to stop the progression of the disease to visual impairment and to blindness. Now, for those who come visually impaired, you just have to be sincere with them. I tell them this is irreversible. Like a patient who has had surgeries in the US, had done this, I told him, now you go. You have tried. Don't go further. Don't need to go to Australia or Timbuktu. You have tried. This is glaucoma. Now, we cannot reverse the disease now, but we can protect what you already have. That is the key thing. The key word is that we can protect what you have. You won't go blind. But we need you also to help yourself, your mindset and your entire being. And we also need you to be disciplined.
Yeah.
We are not going to reduce, if the drug is 3 times a day, we are not going to make it once a day because I not get the number. No, it is what it is. This is the frequency. This is what has been over the years known. If you use it 3 times, it's excellent. It will be able to work. So then for those who come blind, yes, it's difficult, but you talk to them. Life has not ended. Do you know that you can? Your children call you. They say, "Say, call me," so you can offer advice. It says so. If a child of yours or a ward of yours has any problem, they can call. They say, "Yes." Don't you see? You are still alive? Don't you see that you are being of help to your children? Don't you see that they need you? So you need to be alive. Now we're going to put you on medications. Why? If you don't put your medications, these pressures will grow so much that it becomes painful, and it's not good for you to have painful blind eyes. So first, for those who are not visually impaired, for those who are mildly visually impaired, for those who are moderately visually impaired, for those who are severely visually impaired, and for those who are totally blind, you need to counsel them. For those who see, okay, it will not get worse than this. And then we want you to begin to encourage yourself. Don't throw in the towel. Don't say life has no meaning anymore. Yeah. So depending on the stage of vision, you can talk to the person, and then people also come and say, "But doc, these drugs are costly." That I say yes. Because they're drugs. We don't make them. But what I will tell you is that talk to caregivers, talk to your relations, talk to your people, to support you. Those people that will bring cow when you die, let them monetize it now and begin to make sure that you don't grow totally blind.
Yeah.
That yes, you see, you have the visible vision. You can go out when friends visit you. You can escort them to the gate, to the door. A little away from the house, maybe say 10 meters or 20 meters. Then you come back to the house. That's good. We want you to maintain what you have, and that is what we tell our people, so they don't feel bad. And then, very annoyingly, when we tell you this is irreversible, your vision cannot be improved. Now, for those who still have another issue like refractive error, when the pressures are brought to normal, we then refract them to know whether there's a need to give them glasses to improve their 1 or 2 steps. Is okay. That's good. Now, for those who have been refracted, despite everything, there's what we call low visual aids. Now, those low visual aids help people who are moderately and severely visually impaired. Like if you can paint their room white and make their plates using dark color, so that it creates contrast.
Yeah, it could help.
Yes, it could help. So there's what we call low visual aids. This is a very important aspect of glaucoma management. Wow. So that those who are visually impaired will still be relevant, will still be able to do daily tasks. So this is what we're telling our people. Don't give up hope. Don't see a doctor, see an ophthalmologist, so that you can be well guided.
All right, you can be well guided. But ladies and gentlemen, let's be guided right here by opening up the phone lines and taking your calls. So feel free, call if you've got question to ask Dr. Obinna. She will be right here in the studio. This is a program for the eyes, and today we're talking about the older adults. And yes, each and every one of us are gonna get old, and when we get old, we are prone to all of this and more. If you've got questions, feel free, call in, ask your question. The numbers are 0704 550 2840, 0909 771 1009, and you can also call 0902 311 1009. Or perhaps you're an older adult with concerns about your eyesight, or maybe you are caring for someone like your parents or grandparents, and you need professional advice. Now is the time. Hello, good morning to you.
Good morning to you, sir.
Yes, good morning, sir.
Good morning, Dr. Obinna.
Good morning, sir.
Like the old soldier you know before.
Welcome.
Good morning, old soldier.
Okay. Thank you seriously for the teaching and the efforts. For me, the last time I came for your outreach, it was very difficult for me. That time till now, due to financial problems, I cannot be able to add more drugs for my own, and my own typically go down. But I can sit down for one place from minute to night. Mostly, my problem is for head. I can't sleep for night, and if I manage to sleep for night, 1 hour. If I sleep out to me, the day will be worse for me more than another day. It happened to me just like that. I don't know. I know it's not true. My body says I just try to encourage myself to do towards the problem or hardship make me just to throw the towards it. I encourage myself. That is for that. And the other hand of it, there's a time they say if I get some phone and you will help me to make call. This call they make like because I send the number for me that I use button phone and press the phone. Apart from this, I cannot make another call. If I miss the number, I will call another person. Just like that. Then I put some Android phone. Then they tell me say there is some app where they may help me the call. That I try to
old soldier, is there a question you want to ask, please, so we can take other calls?
Well, yes, because I believe
all right, old soldier. Thank you. Hello, good morning. Yeah. Hello. All right, do call back. Yeah, Doc.
Yes,
you had old soldier.
Yes, old soldier needs. That's what I said. In this era of WhatsApp, I know what my people do is that for people who can't afford a particular treatment. They come on air they talk to the home branch chairman or talk to the village chairman, and these things are well laid out, and people say, this our brother is going blind though, and he needs his drugs.
Yeah.
They say, how much? And then you see that people taking up months. It's okay, I'll provide for January, I'll provide for this. Why am I saying this? These are the people. Many of them never knew. They've never known about his visual status, his condition.
Yeah.
And that's why I said people should speak out. Don't die in silence. Talk to your relations. Don't say nobody will help you. No, say it so that if they don't help, it is obvious that they didn't want to help.
All right, let's take one final call.
Hello.
Hello.
Good morning.
Good morning.
Just from.
Can you turn down the volume of your radio set?
Okay. Thank you. Is it okay?
All right, go on.
I'm happy with the program because I used the opportunity given to me that time to go for checkup, and I realized that it is good to really do checkup. I was told to be eating fruits and less of carbohydrate food. So, and I was given an appointment maybe by November was ending. That's an opportunity. Great one. Thank you so much.
All right.
There's one word you use. I don't understand. You say old class. And another one was talking anthropologically, something like that. The meaning and the spelling, please. Thank you.
Okay, thank you very much. You made mention of your analogy of making use of old car and the human body.
Human body, yes. Now I could just say that the older the car gets, the more the car frequents mechanic for it to remain relevant in the next, say, decades. So the same thing with the body. The more you have a proper checkup, comprehensive checkup, the more you are likely to live longer. And then you see people who are 90 and they are still stable. And that's why I said start on time to begin to inculcate positive habits, exercise, eating well. You mentioned the vegetables.
Yeah.
Yes, vegetable and fruits. And as you grow older, less carbohydrate, less oil.
As you grow older, less carbohydrate, less oil. Well, Vok, finally, if there is one message that you would like every older adult, you've started already with less carbohydrate, less oil, as well as not just older adult, also every family members listening today to remember about glaucoma, what will it be?
Yes, my advice would be everybody. People tend to listen and feel that they're not. It is not for them. It's for somebody else. That's glaucoma. In my family, we don't have glaucoma. We don't know who will come up next with visual impairment. We don't know who will slump. So I think our people should do the needful. Why we say this? Say, they say prevention of disease is better than its treatment. And then if you are caught on time, now for a disease does not have early symptoms, that the symptoms come late, it's not wise for you to come and have a checkup to know whether there's a problem or not. And that is why we keep appealing to our people. You lose nothing having a checkup. Just do that. And for your loved ones, please ensure that you have enough checkups so that they can live longer for you and not come down with any burden to you. Thank you so much.
All right, thank you very, very much. Well, ladies and gentlemen, as we wrap up today's conversation, some very key things that I want you all to know. The risks of glaucoma increases with age, so making regular eye examination is more important than ever. These are some of the things doctor have shared with us, so I'm trying to if you did not listen to anything at all, listen to all these ones. Glaucoma often develops silently, so don't wait for symptoms before seeing an eye specialist. An early diagnosis and timely treatment can preserve vision and help older adults maintain their independence. Family members and caregivers, they play a vital role in supporting older adult with appointments, medication, as well as emotional encouragement. And yes, finally, healthy vision contributes to a safer, more active, and more fulfilling life during the golden years. Once again, Vok, thank you very much.
Thank you.
All right, well, ladies and gentlemen, if you want to, reach out to the eye specialist hospital Tesh Enugu State, or if you want to reach out to them, ask more questions, you contact them with the number 0809 700 2020. 0809 700 2020. Thank you very much for listening to Glaucoma on Radio, proudly brought to you by the Eye Specialist Hospital Church in partnership with Solid 100.9 FM. At the top of